And now for the administration's take on the budget and health care. Joining us now is White House Budget Director Mick Mulvaney. Welcome, Mr. Director. I want to start with something the president told Tucker Carlson on Fox about the health care plan. He acknowledged that the people who voted for him, who sent him to Washington, bear the brunt of a lot of these changes in the health care bill. And he said, quote, "We will take care of our people or I'm not signing it," meaning the bill. How's he going to take care of his people without fundamentally changing the bill?
The same way that we've taken care of people for a long time in this country, which is through competition. I think that's one thing that doesn't get very heavily reported, is that part of the problem with Obamacare right now, and I've discovered this firsthand. I live in South Carolina. We're down to one provider. You can imagine what that does to price competition on costs. It doesn't do anything but increase the costs. And one of the key points of the plan that is in the Republican House right now is it is going to encourage more competition, which will lower the cost for everybody, not just Trump voters.
But the president's remarks here were, having taken all of that into account, knowing that there's competition in the bill, what he was responding to are studies that showed that the tax credits go to the wealthy or the tax breaks, I should say, and the tax credit doesn't really help people who are just above Medicaid. And he was saying that part of what is being negotiated in this interview with Tucker Carlson, he said that's part of the negotiation. So I'm wondering, if that's part of the negotiation, what's he asking for to make it better for those people who are hardest hit?
Keep in mind your first comment about how the wealthy get all the tax cuts. The president promised to repeal all of Obamacare, and that's who was taxed at the beginning. So I keep wondering why folks just want to focus on who gets a little bit of a tax benefit instead of focusing on the fact that we're replacing a truly broken system. But to your point about what we're trying to do is to make sure that folks have various options available to them. They're going to get the tax credit. We're going to have the HSAs, which don't exist anymore. That will lower their net cost, especially on an after-tax basis. And we're also going to introduce this competition. So the president knows, believe me, we know who his voters are, and we're going to take care of them. There's no question about them, but that doesn't mean we're leaving Obamacare in place, because that would actually hurt them dramatically.
I guess the president is, if I'm a working class person, and I voted for President Trump, what am I getting out of this? I mean, just as a political thing, what am I getting?
You're getting something you don't have right now, which is care that you can afford, and that's important. The Affordable Care Act Obamacare wasn't really the Affordable Care Act. It was the Affordable Coverage Act. And those people that you just described could afford to buy insurance, but they couldn't afford to go to the doctor because the deductibles were so high.
But what of these studies that show, a 64-year-old, his premiums go from $1,700 to $14,000? That's not affordable.
It does, but it doesn't take into consideration, first of all, the other things we'll be doing. Keep in mind that the reports that you mentioned don't deal with any of the regulatory reform that Tom Price at HHS is trying to put into place. Doesn't take into account any of the other, what we call the Phase 3 programs that we're trying to push through Congress, such as medical malpractice reform, sales across state lines, and then also doesn't include the couple of amendments that we've agreed to the last couple of weeks. So that the estimates, I think, are just not reflecting the true bill.
So in terms of this first phase, though, the president's basically going to have to, the first phase isn't going to take care of those folks who voted for the president. They're going to have to hope that in the future legislation and through regulation, they'll get the kind of relief that the president is asking for.
No, I disagree. I think those folks will be immediately better off because, again, you're focusing on what it costs to buy a health insurance policy coverage, but that doesn't allow you to go to the doctor. So the real question is, when you get sick, will you be able to go get care? And I think, without exception, those folks will be better off under the new plan than they are under Obamacare.
You mentioned getting care. The president has said, as a candidate, he said about health care, there was a philosophy in some circles that if you can't pay for it, you don't get it, meaning health care. That's not going to happen with us. He's talking about universal care there. You're not going to have universal care after these changes.
We don't have the only way to have universal care, if you stop to think about it, is to force people to buy it under penalty of law.
So was he mistaken when he said there should be...
But keep in mind what we're replacing. What you've got now is we're forcing people to buy it under Obamacare, under penalty of law, and people are still looking for a way not to buy it. So clearly the government mandate doesn't work. The better process, the better function is exactly what we're trying to do now, which is to encourage people and enable them to buy a policy they want and can afford.
But universal care was not really a promise he could make.
Again, the only way to get truly universal care is to throw people in jail if they don't have it.
Right.
And we're not going to do that.
Let me switch to the budget. You said that kind of one of your guiding principles was when you start looking at places where we reduce spending, one of the questions we asked was, can we really continue to ask a coal miner in West Virginia or a single mom in Detroit to pay for these programs? The answer was no. that seems like a good sorting technique, but doesn't it open you to the political question then? Well, what about the president's vacation? You know, when he goes down to Mar-a-Lago, as a candidate, Trump made a lot of President Obama's vacations. Now people are bringing that back to the president. What does a coal miner or a single mom say about these trips down to Florida?
Sure. You could always attack a budget for being political, right? In fact, we are going to do so. But keep in mind who the president wrote the budget for. He wrote the budget for everybody. We've heard a lot of criticism, for example, about different line items in the budget blueprint from members of Congress. That's to be expected. I used to be a member of Congress. I used to represent 700,000 people, and my first job was to represent their best interest. We had special interests at play on the Hill. We had lobbyists at play on the Hill. The president wrote this budget without consideration for those things, without being beholden to anybody except the people, and that's who this budget is written for.
But if you're thinking about the coal miner and the single mom, doesn't savings begin at home? I mean, are there things the president can do to cut back on his own using that test? The coal miner doesn't get to fly down to Mar-a-Lago either.
Yeah, I don't have a business card to give to you today, John, because at the Office of Management Budget, we have to pay for our own business card. So it does start at home, but it's already started.
Entitlements, that's where the big money is. The president said he didn't want to touch Medicare, but he seems to be revising his thinking on that.
Well, I think the promise was he wasn't going to affect anybody, and we haven't with this budget. Keep in mind what this budget is. Sure. This is just the discretionary spending part of the budget, which was a necessary first step.
But he might look at future Medicare recipients.
Let me ask you a question. Do you really think that Social Security disability insurance is part of what people think of when they think of Social Security? I don't think so. It's the fastest growing program. It grew tremendously under President Obama. It's a very wasteful program, and we want to try and fix that.
Okay, we're going to have to end it there. Thank you so much, Mr. Director, for being with us.
Thanks,
and
John.
We'll be back in a moment. And we're back with our political panel. Kim Strassel is a columnist for the Wall Street Journal and sits on the Journal editorial board. Jeffrey Goldberg is the editor-in-chief of The Atlantic. We're also joined by Ruth Marcus, columnist and the deputy editorial page editor at The Washington Post, and Ed O'Keefe covers politics for The Post. Kim, I want to start with you. Where do things stand on the American Health Care Act in Congress?
Uncertain, but moving ahead, I think. Look, what we're witnessing here is the return to old-fashioned politics, and nobody is used to this anymore. And that we had for 6 years opposition politics, Republicans saying no to everything, the president largely ruling from his perch in the White House. This is about a big, fat, beautiful negotiation. And I think it's very important. You had Ted Cruz on. He said he wants to get to yes. This is a guy who was part of the Hell No Brigade for years. So he wants to get there. The Freedom Caucus, you're having all these negotiations. And at the same time, Paul Ryan is very ruthlessly marching this on a schedule through the House to try to impose some deadlines. And I think we'll get a lot more clarity this week when we possibly have a manager's amendment that tries to fix some of the concerns of some of the conservatives.
Do you think Senator Cruz said he was trying to make it better? He's working with the White House of this president with whom he had some serious disagreements in the primary, but he's now working quite hard with the White House. But is he going to be able to get all the stuff he wants? I mean, the Senate says it's technically impossible. He also is asking for things that others have asked for and haven't gotten yet.
Yeah, I would say we've returned to old school legislating, but I don't know that we've returned to old school politics. I mean, I think the fact that he says, I want to get to yes, and is willing to work with the White House. The question will be whether he gets to a point, guys like Cruz, where maybe they got 80% of what they want. Will they, like they did in the past, stand firm and hold things up, or will they go along to achieve the party's big goal? That is the question, and that is something we won't really sort out, I think, until this Thursday, when they potentially vote on a bill in the House that will have changes, but we don't entirely yet know what those changes are. And then down the road, when all these things get merged together, and they decide whether or not certain things get in or not. And remember, this isn't just the most diehard conservative Republicans who've caused so much trouble for leadership in the last few years. These are the guys that represent Miami and suburban Philadelphia and suburban Chicago and the areas that could be under the gun next year in the elections when suburban voters stand up and say, I actually didn't have that big a problem or not as many problems with my healthcare system. You're not trying to dramatically redo it. They looked at those numbers that suggested tens of millions of people would lose their coverage, and that's what gives them pause. So we'll see, but it is encouraging, yes, that there is some wheeling and dealing going on between both ends of the street. The question will be what happens when they don't get everything they want.
Ruth, let me ask you this question. In the Senate, they think the political dynamic will change if something passes out of the House. It's now out of the House, it comes to the Senate, and now are you really going to be the Republican senator who stands in the way of repealing Obamacare? Isn't that going to be, I mean, Ted Cruz was very clear to say nobody hates Obamacare more than I do, but in the end, are they really going to stand against Obamacare?
Maybe. And there's a long way between getting past the House and getting past the Senate, because the Senate is going to change what the House does, and that will change from where it is now. And then I spoke to one of the smartest legislative tacticians I know, who gave this about a 50-50 chance in a conference committee, because you have to satisfy the dynamics of this have really changed. There are moderate senators that you have to satisfy in your own party. There are moderate House members, people who are in 20-something, who are in districts that Hillary Clinton won. They all have issues. They all have people who are demonstrably going to be potentially hurt here. That all has to be satisfied. And then you have the sort of usual Freedom Caucus types. You have Ted Cruz drawing his line in the sand. And while he said he wanted to get to yes, he also undercut a very major argument that Trump administration officials are making this weekend, that there is this third phase that will somehow magically happen. Ted Cruz said ain't going to happen. He's right. So and the stakes here, if it's 50-50, that's a huge thing, because this is not like Bill Clinton's attempt to launch health care or George W. Bush's attempt to do Social Security reform after he was reelected. This is a central promise of congressional Republicans for years now, of President Trump during his campaign. If it doesn't get done, it has serious ramifications for his governing going forward.
Jeffrey, this is a marketer president we have who knows how to put a name on a thing and make it popular. What do you make of the pickle, what he's got to face here, which is, the idea of a three-part plan, which the president talked about, but Ted Cruz says, not going to happen.
I actually step back even further, going to sort of jumping onto something that Ruth said. I don't even understand why they're doing this now. If you're Donald Trump, you know that your infrastructure plan, your idea to rebuild America, bridges, tunnels, airports, this is a sure winner, because you're basically daring Republicans not to go with you, and the Democrats are with you. I simply don't understand why they have phased this the way they have phased this. I understand that it was a core promise. I get it. But infrastructure was a core promise.
But when you talk about it for 6 years,
yeah, but they've also been talking. He's been talking about making America great again. He's also been he's not been talking just about Anyway, I'm just questioning as a marketing question. It seems to me that one of the things you would want to do is put as many white, male, high school educated Americans to work as quickly as possible. And so I'm not sure that, I think when the history of this is written, I'm not sure that this is going to be seen as a genius political move.
Let me ask you this, Kim, on sort of building on that a little bit. There have been these studies, and the president acknowledged it in his interview with Tucker Carlson, that say that the Trump coalition, working class folks they're not getting the size of the tax break that people at the upper end get, that the tax credit that's a part of this healthcare doesn't really help them as much as Obamacare did. So, to Jeffrey's point, if I voted for the president, wouldn't it be better to have an infrastructure that's got jobs associated with it? Whereas this is, you're getting a theory that hopefully will play out and work in practice.
Look, Obamacare obviously affects many different people in many different ways, but there are many, many self-employed people out there, anyone on the individual exchange for whom this is a big hurt at the moment, and it is something Republicans ran on for 6 years. And whether or not it was the correct decision to move on it first, if they fail in this now, it potentially derails everything else that they want to do, whether it's infrastructure or tax reform. And look, I think the other thing that gets missed here is that there need to be some fixes to this bill. It is not by any means a perfect bill, and especially in ways that will reduce premiums. But when you step back, this is the largest entitlement reform that has ever been contemplated in this country. It's going to save $1.2 trillion. It's cutting out another nearly $900 billion worth of taxes that were going to be imposed. So there are some economic benefits to this, and just some wide philosophical principled points here that are also make it a worthwhile endeavor for Republicans.
Including the Medicaid block grant, too, on
exactly.
that point.
What Kim calls entitlement reform, I would call something that could actually really hurt core Trump voters. If you are a rural voter, a lower income voter, an older voter who voted for Donald Trump, this plan is not for you. And you could hear President Trump in some interviews this week recognizing that that was true. I would keep an eye on the amount of credit that is going to older people. Sorry to say older people between 50 and 64, some of us may be there, who I think their
tax credits in the bill to help
tax credit is going to very well could be increased as part of an effort, not just to get this through the Senate, but to get it through the House. You sort of do that, and that calms down some people. Then you put in some work requirements for Medicaid, that calms down a different group of people. But there are clear core Trump voters who are going to be hurt by this as laid out.
I don't know
and
if that's
even
clear.
But it is. Well, I mean, it's clear if you believe CBO. If you don't believe CBO,
well,
then
right,
and
there are obviously, like, if you believe CBO, then twice as many people were supposed to be enrolled in the exchanges already.
Look at logic. If you if you allow insurance companies to charge older people more, if you reduce the credits to them, if you allow people in rural areas to be charged more rather than making the credits change amounts based on where you are geographically, then it's simple logic and arithmetic that there are going to be these people who are hurt.
Well, not necessarily if insurers are finally allowed to craft plans that don't include all of these mandates and give people more freedom and flexibility to bring down deductions. But anyway, we're ignoring the voice.
This is why Thursday will be very interesting if the House indeed votes on something, because there's all these unresolved questions.
Including the CBO number that said, and that number, there's been a lot of discussion this week about the Congressional Budget Office. They have been off in the past, but 24 million is still, as a political matter, a number that floats out there.
Huge problem for a lot of these, again, the more moderate Republicans that will be in trickier races next year, and a few Senate candidates, the few Republican Senate candidates that could face tricky re-elections next year. Dean Heller out in Nevada has said, I can't do it because of that.
All right, we're going to take a break here. We'll be back with our panels, so stay with us. And we're back with more from our panel. Jeffrey, I want to start with you. Monday, the director of the FBI is going to testify in the House on the question of Russian meddling in the election. Nancy Pelosi wants him to come out and basically put to bed this wiretapping claim. The president, in a press conference on Friday with Angela Merkel, said that they shared a common bond of being wiretapped by the Obama administration. What's going on?
Safe to say she does not feel a common bond with Donald Trump on most anything.
She did not appear
both
to
human
pick up,
organisms breathing air.
She did not pick up the baton in the conversation. What do you make of where we are now with the president on this claim?
So the fascinating thing about our conversation, actually, is that part of our conversation is about the normal political horse trading in Washington, talking about CBO scoring, and then there's this other part of Washington now, which is this kind of what's a nice word? Non-logical part that's going on, that's not rooted in facts and observable reality. You asked the question, will Comey be able to, will the FBI director be able to put this to bed? No, he won't be able to put this to bed because people believe it, and apparently the President of the United States still believes this, or at least won't back down from what he's said. I would note in this sort of whirlwind week that the president managed to alienate two treaty allies anew. I mean, he's already alienated other treaty allies, but his discussions with Angela Merkel seemed semi-disastrous, and then he completely gratuitously, and related to, of course, this issue of whether President Obama spied on him, he completely gratuitously, or his administration, really put out this idea that the British, our closest ally, were somehow involved in spying on him on behalf of Barack Obama.
His administration, in the form of Sean Spicer, put it out, and then he chose the press conference with Angela Merkel to reaffirm it, further inflaming this. It just goes to show you, yes, actually the president is doing a lot of very diligent horse trading, getting to yes work on the budget, I'm not on the budget, on healthcare, like a regular president would, in some ways better than his predecessor in terms of his dealings with members of Congress. And then we have Crazy Town, which is saying
something. That's another
term
for it. I was not going to use, but that's another term.
I'm going to go there. Saying something that has no basis in fact before you check it, and then, as Donald Trump has showed us for months now, refusing to back down even when you are demonstrably wrong.
We actually do know two things. that are facts so far, at least as expressed by the Senate and the House Intelligence Committees, which are, one, that they couldn't find any evidence of actual wiretapping of Trump Tower. Does that mean that Trump was surveilled in some other way? We don't know that yet, and they'll continue their investigation. We've also now had both James Clapper, who used to be the head of intelligence for the Obama administration, and Devin Nunes, who runs the House Intelligence Committee, just today say that there's no evidence of collusion between the Trump team and the Russians with regards to the election. So I think that those are important things to get out there. We are learning something. They will continue their investigation, and it's going to go into a lot of other things that don't get as much coverage, like, for instance, who's been doing the leaking out there.
Right.
Well, when President Trump, as candidate Trump and before he was candidate, pushed the birther myth, that was offensive, but it wasn't damaging. Here you have an accusation that's damaging on a lot of levels. First of all, it's accusing whether wiretapping is in or outside of quotes, it's accusing his predecessor of a major violation of federal law. And then it's causing these problems with a major ally, with Britain, gratuitously, and then keeping going on that.
I want to get to a couple other things. Ed, you've spent a lot of time talking to the members of the Judiciary Committee about the Gorsuch nomination, which, if any conservatives are worried about things like these wiretapping claims, they're very happy about Judge Gorsuch.
So, yeah, incredibly so. I spent the bulk of last week talking. I mean, look at some of what they said. Cruz, who you spoke with earlier, said the most transparent Supreme Court selection process in modern times. Remember, he had his differences with Trump. Jeff Flake, who never endorsed Trump, said that both in style and in substance, it's a really good pick. Mike Lee, who's sparring with the White House on health care, I don't think it could have gone any better. And Lindsey Graham, who spars with the president any day of the week, calls Gorsuch an A+ and says this has been the single best thing the president's done, was to pick Neil Gorsuch. Republicans are in lockstep in the Senate with the president on this. They are excited about it. They are thrilled about how well the rollout has gone so far, and they are confident that Gorsuch will sail through this week. What's been most interesting to watch is Democrats really toiling amongst themselves about how to react. Do you block him? Do you throw everything you have at him? Or do you perhaps hold back a little bit? Because inevitably another vacancy will come. Trump may get to pick that person, and he could be even more conservative than Gorsuch.
We've got just a short time, Jeffrey. I don't want to leave without the rollout of the Secretary of State, who made a trip overseas. Give us your
secret
sense
rollout of the Secretary of
Well,
State.
because he didn't travel with a press corps.
Right.
He said some new things about North Korea. Give us your sense of that in 30 seconds.
Well, I think there were some innovations. He's talking about all options being on the table. He's put out the idea that there could be a preemptive U.S. attack on North Korea. Now, of course, North Korea has been a problem for decades. The crisis is generated by North Korean extremism and illogic. But I come back to this general conversation about the way the Trump administration does things. On some levels, on Gorsuch, it's smooth. On healthcare, they're having a reasonable debate. The question is, on matters of life and death, I'm not confident yet that these guys can handle a crisis. Because remember, nothing really has happened yet in the Trump administration. There's been no terror attacks, nothing of North Korean magnitude. So it remains to be seen whether these guys have a handle.
All right, we're going to have to end there. Thanks, all of you, and we'll be right back in a moment. That's it for us today. See you next week.